Okay, we are doing our second assessment for Nursing 351. We are going to be doing the peripheral vascular system, the head, eye, ears, neck, throat, and the lymph system. First, we'll begin with just a general inspection. We're going to look at the patient's head, hair for distribution, looking for any lesions, scarring, lumps, bumps. Also looking at their skin for lesions, bumps, symmetry of the face and the ears, and the size of the head. So everything looks good there. We'll move on to just a little bit of inspection. We're going to check the sinuses. We're going to check the frontal sinuses for tenderness and the maxillary. Since it is fall in Kentucky, you may have some tenderness here. Doesn't appear to. Okay, we're also going to go ahead and palpate the patient's ears, and we're feeling for the auricles, any lumps, bumps, tenderness. Let's see here. We'll also check for the lymph nodes. Alright, it should not be palpable, but again, it is fall in Kentucky. Okay. When I ask the patient to swallow, we're going to check their trachea for midline here. Okay, and we're going to typically stand behind them at a lack of room, but you feel behind and check their thyroid from the front there. Okay, we also want to look at the patient's eyes a little more. We're going to check the sclera for any redness. I also want to check the conjunctiva. Here we go. A little tall here. Checking for symmetry, shape of the pupils. We're going to also check their pupils for reactivity. So there's going to be a bright light shining here. We're looking for direct and consensual. Also, we want to have the patient tilt his head back just a little bit. We're going to check the nose. We're checking the external nose for symmetry, lumps, bumps. We're also going to check inside here just for any deviations. All right, and the patient look back down here. We're going to check the mouth externally. Should be pink, moist lips. The patient show us her teeth. All right, and we're going to check the gums and teeth. Check the roof of the mouth. Have the patient look down a little bit. We're going to look in the floor of the mouth. You can move your tongue around. A tongue depressor would be helpful at this point. Check around. Can you stick your tongue out? Okay. And we're going to look at the back of the throat here and have the patient swallow. We're looking for the pharynx. All right. We've got it. Okay. We also are going to check for the pulses here. We're going to start here with the brachial pulse. While we're at it, we're also going to check for their lymph nodes. And we're going to have them extend both arms. While we're checking the pulse, we're also looking at the skin, feeling of the temperature of the upper extremities, looking for any edema, and check the pulses. Okay. Strong pulses. Moving down to the brachial pulses. Okay, great. And we're also going to check their lower extremities for the same thing. We're looking for any edema, the skin color and temperature. We're going to check both sides. Okay, and you check the patient's femoral pulse. Typically that's best with the stethoscope. So we're going to feel for the popliteal pulse. Obviously if they have a popliteal pulse and pedal pulses, then they have femoral pulses as well. So we're not going to do that part of the assessment, but you do check the femoral pulses here, but best with a stethoscope. So we are going to check both popliteal. So we're going to bend the knee for that. hard to feel. Alright, we're going to move down and check the dorsalis pedis down here right behind the ankle. Checking both sides. Okay, and also on the top of the foot here, we're checking for the dorsalis pedis. So earlier behind the ankle, we were checking the posterior tibial. Okay, we'll check this other side here. Okay, we're good. Pulses are both strong on both sides. Let's see. Overall, our patient appears to be very healthy. Everything's symmetrical. Have a good temperature. Patient did not note any numbness or tingling of any extremities. Venous patterns are all good. Pulses were all great. Didn't feel any palpable lymph nodes. I will rattle off the ones I was looking for. Unfortunately, they're all a little hard to pronounce. We were looking for the preauricular, the posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, the supraclavicular, and the epitrochlear, which we checked while we were checking the pulses and the bend of the arm there. So yeah, that completes our second assessment check off. Thank you so much.